Bismillahirrahmanirrahim. We are here with another most important topic, that is grading and staging of cancer. Grading means establishment of aggressiveness or level of malignancy. What? Aggressiveness or level of malignancy based on cytologic differentiation of tumor cells and number of mitosis within the tumor. Means it is done on pathological grounds. Grade 1, grade 2, grade 3, grade 4 are there. Staging is a method by which the extent of spread of a cancer is determined. Like by grading, you determine the aggressiveness, a level of malignancy, and by staging, you are supposed to determine the extent of spread of a cancer, and that is based on size of primary lesions, extent of spread to regional nodes, presence or absence of metastasis. Two methods are there. One is called TNM system. T is for primary tumor, N is for regional lymph nodes, and M is for metastasis. T1, T2, T3, T4 describe the increasing size of primary tumor, while N0, N1, N2, and 3 indicate the progressively advancing lymph node involvement. M0 and M1 are there, that will indicate the presence or absence of metastasis. And AGC method is there. It involves the stage 0 to 4, size of primary lesion, presence of nodal spread, and metastasis is there. Let's talk about the diagnosis of cancer. It can be done either by screening, cytological examination, histological examination, serological examination, or radiological examination. Screening means it is performed on asymptomatic individual to detect the tumor in early stage. For example, mammography to detect the breast cancer, or you talk about the sigmoidoscopy. What is sigmoidoscopy? It is a procedure that is carried out to detect the colon cancer or precancerous adenoma of colon and rectum, and carried in persons greater than 50 years of age. Cytological examination is an accurate method. In it, exfoliated cells. What do you mean by the term exfoliated cells? It means that either the samples of the body fluids, whether you take the sputum, whether you take the urine, or whether you take the CSF, the cerebrospinal fluid, they are taken for examination. Brushing or scabbing of epithelium is another method, that in it the lesion that has been visualized by endoscopy may be performed to obtain cells for examination. Fine needle aspiration is also there. Histological examination is carried out, that is a method to establish the diagnosis of a neoplasm. Examination of entire neoplasm removed at surgery, or incisional biopsy, or a large bore needle. For histological examination, you need a complete specimen. For example, any neoplasm that is removed by surgery or by other means like incisional biopsy, and then you place that sample under the microscope to do the proper histological examination. It reveals the type of neoplasm, whether it is benign or malignant, a grade of malignancy, and the degree of invasion. Serological examination, that is tumor marker, is used. What is tumor marker? Let's define it first. Substances, usually proteins, that are produced by the body in response to cancer growth or by cancer itself, and it may be detected in blood, urine, or tissue samples. So these are basically simple the proteins that the body produces in response to cancer. Tissue markers can also be defined as their oncoproteins that can indicate presence of a tumor. Substance in serum or cancer time, if substance is present in serum, for example carcinoembryonic. So what type of cancer it will cause? It will cause cancer of GIT, especially colon. Alpha fetoproteins will cause the hepatoma Yorkshire tumor, and human chorion gonadotrophin will cause the choriocarcinoma. The last method through which the diagnosis of cancer can be done is radiological examination. For example, X-ray, CT scan, and MRI scan. Okay. Let's talk about the treatment of cancer. Treatment of cancer, it can be surgery, it can be radiation therapy, it can be chemotherapy. Chemotherapy, that is anti-cancer drugs. Fine may carry out surgery, you may carry out the chemotherapy drugs, but radiation therapy, in it can be radiosensitivity of tumors. Like some cells are extremely sensitive to radiotherapy, while others are not sensitive. Radiosensitivity of tumors depend upon degree of mitotic activity or degree of differentiation. In undifferentiated cell, radiosensitivity of tumor is seen. They show sensitivity towards the tumors. Let's discuss it. Degree of hypersensitivity in permanent cells that are with no or very low mitotic activity, they are radioresistant. Permanent cells with low mitotic activity are radioresistant. They show no effect to therapy or radiation therapy. So person if is having the, for example, normal cells and tissue adult neurons, if he is having the tumor of ganglion neurons, that is tumor of neurons, so radiotherapy will not show any result. Another patient, if he is having the tumor, for example, sarcoma, glioma, liver cancer, that is muscle, connective tissue, liver, endocrine organs or glial cell tumor, that patient will show intermediate response towards the radiotherapy. Why? Because in these cells, they are stable cells, so they have the little mitotic activity. In labile cells that are having the high mitotic activity, they are extremely radiosensitive. These patients will show the fastest recovery and they may show the very much improvement, high improvement rate, because these are radiosensitive. For example, bone marrow, intestinal epithelium, hair follicle, gonads and skin. So in these cases, if a person develops the neoplasm, so these can be treated with radioactivity. For example, leukemia, lymphomas, germinoma of gonads. One thing to be remembered is leukemia, lymphoma, malignant. So we have already got an idea that even malignant can be treated with radiosensitivity. Next one is hormone depleted tumors. For example, many tumors that are not caused by hormones are dependent on hormones for optimal growth. Let's discuss this. For example, when you say that tumor is deprived of hormone, its growth becomes slow. For example, prostate cancer, it is dependent on androgens. So when by surgical means there is removal of testes or administration of estrogen, so that will definitely lead to the decreased growth of tumor. In breast cancer, it is dependent on estrogens and progesterone, more dependent on estrogen. So if we decrease the rate of estrogen, person can be treated. And in thyroid cancer, it is dependent on TSH. So administered thyroid hormone that will decrease the level of TSH, and that is the way by which the specific neoplasm of thyroid cancer can be treated. That's all about the treatment of cancer, and this was the last video from chapter Neoplasia.